Cool.
We are
Hi.
live.
Are we live? Okay, guys.
We are
I'm
live.
trying to get
Yeah.
to the freaking thing. Again, I told you. If you just go to We Love Pets, that's my most.
Retha, I'm only hearing ping
Every
pong.
week the same thing. Listen, the old tunnies is an understatement. And we are live. There we are. Hi, everybody. Guys, so let's just start and fall with a deer in the eyes. Tonight, we are chatting with someone who works on the side of the veterinary medicine that many pet parents do not even realize exists. But once you really understand it, it makes a complete, utter sense on why you need to do it.
We're
Dr.
playing
Tanya
musical
Grantham.
chairs here at the moment. I can just see little flashing boxes. Then Tanya's gone, then Retha's gone, then I'm gone. So I'm just keeping my fingers crossed. What have we got here?
Okay, from what I see
Okay,
on
we've got a
Facebook,
comment.
it
Good
looks like
evening.
everybody's. Okay, cool.
Great.
Okay, let's say. So Dr. Tanya Grantham focuses on veterinary physical rehabilitation and helping animals recover from injuries, surgery, and chronic conditions, but also helping them to move better, live more comfortably, and often avoid bigger problems down the line. I think it is actually quite fair to say that if you understand the value of veterinary physiotherapy, you would really see the benefit and you could prevent so much things that can go wrong later in your dog's life. I love Tanya's approach, and it is incredibly collaborative and holistic. And she's looking at the whole animal and working with professionals to get the best outcome for our patients. Welcome, Tanya. It's really great to have you here, and I am looking forward to what you've got to tell us today.
Perfect. Thanks, Retha. Hello, Antonette, and to all the people that are
Hi.
live online. Thank you. Thanks for this opportunity.
Great stuff. We got a hello from Mr. Miyagi. So, hello.
Oh, okay. Hello. There's a voice from a while ago. Haven't heard from Mr. Miyagi for a while.
Yes,
Mr. Miyagi.
Always good.
Mr. Miyagi, I think, is a real ambassador for the value of physiotherapy and rehabilitation.
Hundreds.
So, yeah, it is definitely
100%.
a great what feel good story. So,
for sure.
Antonette, are you going to fire away?
All right. Tanya, I heard a little birdie that at 5 years old, you already knew that you wanted to be a vet. So what was the first pet that you saved or helped, if you can tell that story?
Well, the first animal I saved, which decided me. So I grew up on a farm, and I mean, I was always about animals. And my parents tell me from the moment I could walk. I think that's quite typical for many vets. But I wasn't quite at school yet, so I must have been around 4 or 5, probably about 5. And we had 2 fox terriers, but the old-fashioned foxies, not the ones that we know from the UK, the South African foxies with the long legs.
The proper ones.
And well, depends on which side of the ocean you're on, right? But they had cornered a lizard in the flower bed. And so they were biting it, and I stepped in. You know, you can imagine a 5-year-old stepping in between these two. I'm invincible. I have no fear. You are actually messing up this poor little lizard. And I managed to get them off the lizard. And I picked up the lizard, but poor thing had bite marks in him. I don't know what. And I had him in my hand, and I took him to my mom. But the tears were streaming down my face. It was like, and I was so angry at the dogs for, like, what were you doing that for? I mean, what do you understand when you're 5? Anyway, needless to say, the lizard died. But when my dad came in from the lands that night, I told him I'm going to be a vet. So I can't say I really saved the animal, but it certainly was the moment that I knew this is where I'm going. Yeah.
That's brilliant. Yeah. That's a great memory. That's
a calling in the making.
Yeah, and I love
Huh?
Carry on.
So my daughter used to say she wants There's a
I'm shutting
delay.
up. Retha, go. Retha, go.
My daughter used to say when she was 3-4 years old, she wants to become a ek wil 'n tandarts word wat diere gesond maak. Used to say she didn't become a vet. Sorry guys, my dogs are all around here. I'm sorry. I'm having
It's a
little,
show for the dogs. It's
little
gone
bit
to
of a
the
racket
dogs.
for mom's attention here. Yeah.
All right.
Yeah.
So at 5 years old, you knew
Sorry,
that's where you're going. You're going for a vet. Why did you choose physical rehabilitation? Why that side of vet medicine?
Well, I followed the traditional, more traditional, what people know. So when I graduated, there weren't very many jobs. I actually wanted to be a cow vet, but a little English girl in South Africa in the middle of the 90s, but nie baie vlot Afrikaans kan praat nie, was a little bit of a, it was a bit of a risk. And there were actually not a lot of jobs available. We were in the middle of a recession. So I got a job in a small animal practice. And so eventually I became a partner, not eventually, pretty soon after I graduated. I did the normal small animal veterinary work, all the after hours, all the weekends, all the surgeries, all the parvo puppies, all the vaccinations. I even ran a little puppy class for a while at my practice. And that went on for about 7 years. Then I bought my partner out and I was running it on my own, which was an ideal recipe for burnout. I got very ill and I had to have lots of surgeries. And in that process, because that surgery and the illness process lasted for about 4 years, I actually got another partner. And then when I realized that I needed time out to get better, I sold my shares to him. And then I took another 2 years to regain my health. And in that time, I started investigating other therapies, more for my own health. So I'm talking energy modalities. I'm talking acupuncture. I wasn't so much into diet then, because when you're 30-something, that doesn't really matter much. But certainly it took me down a different route. And because I'd been doing my own surgeries, I mean, I graduated before we had veterinary orthopedic specialists or veterinary surgery surgeons. I was doing a lot of the surgeries, a lot of cruciate surgeries, a lot of patella surgeries, a lot of femur head amputations, and particularly the patella ones where the patella luxates or dislocates and gets put back. I would say they were the ones that impacted me the most, because the technique I was using, the surgeon's the same, the technique's the same. 50% of them recovered and 50% of them didn't. And that question stayed with me. So when I was recovering, I started investigating actually hydrotherapy. And I went and did some training in the UK. Then I went and did acupuncture training in Scotland. And eventually, when I got better, I thought, I locumed for a while and I thought, actually, I don't think mainstream practice is for me. And then I decided to open up my hydrotherapy center and my acupuncture and pain management center in 2009. So that's when I opened my first one. And I always had this idea, well, if it doesn't work, I can go back to mainstream vet. Well, here I am now, 18 years later, and it's just gone from strength to strength. So it started with my own ill health and my own questions. I think as a vet, and actually in any profession, the more you question, the more you look and ponder, like, why does this work and that doesn't work? Why if I use this approach, do my clients respond better? Whatever it is. So, that set me up for all the questions, set me up for this path. And it's been amazing for me. Like, I've really loved learning. Like, I love learning. I was kind of like one of the pioneers in South Africa that started with small animal rehab. And it's been the most amazing journey for me. Yeah.
How have you seen pet parents kind of go through this evolution as well? Because obviously But then when you started, it wasn't something that was mainstream at all. And kind of bringing it into today, have you seen a change? Has there been a shift? Are people more open to it?
Well, there's been a huge change. I started off in 2009, February 2009, me only, doing everything. You answer the doorbell, you do the invoicing, you take the money, you clean the practice, you do the treatments, you greet the clients, you say goodbye. That whole thing I did for 2 years before I got my first therapist. And now Animal Health and Hydro has 6 facilities countrywide. So that evolution, so I think that speaks a lot for how has the awareness changed, but also how has the awareness within the pet parent evolved to, I think we're also changing. I mean, when I grew up, I used to fight with my dad because the cats weren't allowed inside, never mind the dogs. Now it's almost unheard of that the dogs sleep outside. The dogs are inside. I mean, look at Retha, her dogs are all in there creating havoc. And so what would our lives be if we didn't have our companions, our animal companions inside? And because of that, I think as pet parents or as guardians, we become a lot more aware. And then COVID came along, and many of us, we were locked in our homes with our dogs and cats and other animals. But let me just talk about dogs and cats. For 5 weeks, we got to know them even more intimately than before. And now, and then it really became, oh my word, look at how I impact my animals. Look at how my animals impact me. And so there was another step in the evolution of, well, if it works for me, can it work for my animal companion, and so on. So and then what has also helped us, I mean, some people will say it hasn't, but the internet and the information age has just made so much available. And I believe that the pet parents have the power, if they choose it, to drive the evolution of the veterinary profession. So the more you ask for collaboration, the more you ask for conjunctive therapies, like whether we're talking nutrition, whether we're talking acupuncture, whether we're talking physio and pain management, whether we're talking homeopathy, animal communications, I mean, name it. I believe that if we start having those conversations, and many people have conversations like that with me, and I have quite a big network also, you as the pet parents have the power to drive the future of not only the veterinary profession, but also what it is that you want for your animals, for your companions.
Yeah.
I do
Tanya,
think we need to be
you are
cautious. Yeah. Carry on.
I think you are hitting the nail on the head there. If it comes to pet parents being more aware and driving it, we as pet parents totally underestimate the power that we have got. And I think that is what Two Aunties and their Dogs are all about, is to teach pet parents that we have got a voice, and the more we know and the better we understand it, the better we can drive and ask for more inclusive, holistic consults and information. And I think that is a very important part that your colleagues need to start understanding as well. It is the modern vet practice has changed a lot. It is no longer something that just do the conventional things, because the conventional ways has not got all the answers. I mean, we speak to vets all across the board that is in a more holistic field. And why have they become like that? Either like you, where you've got a personal health issue and you realize I need to do better for myself, and then start thinking, but this is bringing me on a path where I can do better for pets. So yeah, it is really, really, really very important that pet parents drive this.
Yeah, having said that,
one of the things.
So my word of caution is that as a pet parent, do your research and build the relationship with your vets so that you can have the conversations, and come with vets or scientists. And there is a really important thing for you to recognize is, or for anyone, myself included, and we want to be able to provide therapies that have a sound basis within science. Okay, and here I'm gonna maybe be a bit controversial. If you look, let's just start with acupuncture because it's something that I know very well. Acupuncture, if you go into and do a PubMed search on acupuncture treatments, there are more than 18,000 research articles on PubMed. And yet many of my veterinary colleagues will go, oh, it's all just woo-woo. It's rubbish. There's nothing that, and now we understand that it really works on the nervous system and it works on releasing neurotransmitters. That's all biology. That's all science. So the moment we can start introducing those concepts and have those conversations also as the pet parent, the more you will influence what is happening and what are the treatments that you have available to you.
Yeah, Tanya, you've actually just answered my question, because one of the things I often get asked by pet parents is, how do I approach my vet? And how do I kind of engage my vet so that we can try other ways, not the conventional Western medicine way? So I think that collaborative approach is important.
Yeah, I think there's a number of factors. One, is your vet, do you have a relationship with your vet, first of all? Because if you walk in there as a total stranger and you want to change the way the vet is working, chances are you won't have much success. So I believe that your relationship is huge with your vet. And also because who are you going to call in the middle of the night? It's not Ghostbusters. They're not going to come and help you. Now, you know how old I am, who are you going to call? But so you want to have a relationship. The better your relationship with your vet or your veterinary facility, because there's often more than one vet there, the more you can ask these questions because they're getting to know you, or they do know you. So, thirdly, how much of an open mind do you have, and how much of an open mind does your vet have? Because that's key. We need to be willing, or you need to have conversations with people who actually do have more of an open mind. Some don't, and some of us are too old to have an open mind, and that's also okay. So there's a discernment that also needs to happen on the parts of the pet parent. Then you're going to introduce something that maybe the vet knows nothing about. Vets don't it's a serious disease within our profession. We feel like we have to be perfect and we have to know everything. And I speak from experience. So I don't want someone showing me up and asking me questions about things of which I know nothing. It's easier for me to block it than it is for me to actually open up and say, well, you know what? Blow me down. I have no idea. But I can go and research it and then I'll phone you back. But it takes a specific kind of person to be able to do that. So is your vet open to that? And I'm not lambasting vets. I mean, it happens in every profession. Some accountants only want to use a particular program and nothing else. And the last factor that I think, and now my mind has gone blank. But it was more of a relationship factor than it was the science or anything like that. Is it's just that's what it was. It's like we live. This is what I've experienced in my 30 plus years of being in the veterinary field, and I see it in the human medical field as well. Is that as a population, we have given away our power to the medical professions, the veterinarians, the lawyers, the accountants. We expect them to solve our problems. And then when they don't, we're upset. How about being a bit responsible and accountable for the problems you have and meet the vet at that place Here's how I would like to contribute to solving my dog's problem or my cat's problem. Could we have a discussion about it? So you're not coming to the vet going, here's what I want you to do. So it's not confrontational, but to have those discussions, you first need to have the relationship. So and also from the power perspective, traditionally, I've had many people who, I must just fix their dog. Well, that's beyond my scope of practice because we are partners. This is how I view it. We work in a triad. It's me, it's the patient, and it's the client or the pet parent. And each one of us has a specific function and a specific responsibility and role to play within the relationship and within the well-being of the pet. If I can give you a physio example, your dog has just had a slip disc. It's gone for spinal surgery. The surgeon, you've spent tens of thousands of rands on this dog. And the surgeon has said, you need to cage rest this dog for the next 6 weeks. And then you don't. Because you can't. Because it's a Vorshoenkie that's grappling at the cage and barking and jumping up and down. Okay? And then when the surgery is not successful, it's the surgeon's fault. But there are really important repair physiology things that have to happen in the dog being cage rested. So let's have a conversation about how can we work around the nature of the dog. We're not going to change it. So what are the options that are available to us to manage the movement as opposed to I can't cage rest my dog or I won't cage rest my dog. So I don't know if I'm really explaining myself well, but exactly. But it's cruel if your dog has a persistent back problem that you keep on throwing money at and you expect the vet to solve if you aren't bringing your part into the relationship. So we've given away our power to the vets and to the medical profession by saying, fix my problem. I'm not part of this problem. Sorry, I've gone straight into something now which could be pressing something.
I love this because we are so accountable and we are giving away exactly what you said, and we're not playing our part. We're just sitting there. It's like, oh, the vet's going to fix my dog or my cat. And, it's a simple analogy, but with the rescues as well, I see it, they adopt the new dog and the new parent expect the dog to be like happy, settled in. We're going to go to the park. We're going to go to the restaurant. We're going to do all these things. And this poor dog is like, what is going on? Where am I? So there's the complete misalignment almost about the pet parent and their responsibility and the role of the vet and how we fit like puzzle pieces, and we have to kind of complement each other for the therapy to work.
Yeah, and we have to have conversations about it. Carry on, Retha. Sorry.
I think the conversations is the very important part because I think that is where pet parents needs to understand better what is veterinary rehab. Even before it's there, when they get this Dachshund puppy and it goes for its first checkup at their vet, I think that is where the conversation should start taking place, is why is it important and why it is not cool to be able to crate train your dog? Why is it important to do puppy yoga with your dog? Why is it important to have a vet physio on your suppliers list? Good food, good veterinary care. I think veterinary physiotherapy is a must, even if there's nothing wrong with the dog. If you decide to adopt or get a puppy that is a Dachshund, you are most probably has got a 90% chance that you're going to have an issue. If you start this from the beginning and do preventative care, you can save a lot of money and a lot of heartbrokenness, and you're definitely not cruel. So that I think is important. That maybe Tanya, tell us a little bit of what more insights on what is veterinary rehab, because I'm sure for a lot of parents this is a totally complete new concept. And veterinary physical rehabilitation is really, what is it in practical terms, and how does it differ from general veterinary care?
Okay, that's, I mean, really, really good question. I'm so glad you asked. So let's look at a human medical setup first. Let's say you are a sports person, and let's say you're a rugby player, and you've been in the scrum, or you've been tackled, and typically now you've torn your cruciate ligament. So die kruisligament, it's in die knie, and the first place you go is you go to the doctor or the sports specialist doctor. He makes a diagnosis. And then he says, okay, let's say for this example, you need to have your cruciates surgically repaired. So you have the cruciate surgically repaired. And within a day or two, you're back on that leg. It might have a brace. You might have some crutches. The first place you go after that, because now the surgeon is done, the doctor's done, the next place you go is the physiotherapist. And the job of the physiotherapist is to get you mobile, to get you moving. Okay. It's not to get you sports ready, it's to get you moving. So in the veterinary field, when we talk about a veterinary physiotherapist or a veterinary rehabilitation practitioner, because they've come from different training backgrounds, they can do that. But the next thing that they do would be similar to a biokineticist in the human field. So the biokineticist is the one almost, and I do stand to correction, and I'm sorry if I offend anyone in the medical field, but this is how I've put it in my own brain. The biokineticist is the one that takes you from, now you're mobile, now I have to get you to be able to go back on the field. And I think there is overlap between bios and physios. So, I stand under correction. So we've also got a component within veterinary physiotherapy or veterinary rehabilitation where we take the dog from injury to mobile, and from mobile to functions of daily living, or to, if it's an agility dog, back into the ring. Okay, so we've also got a big spectrum of, does the dog have a function? What does the pet parent need at the end of this? And that varies as well. So we will adjust our program accordingly. So we can be involved as a veterinary physiotherapist or as a veterinary physical rehabilitation practitioner. We can be involved from the moment before that dog even wakes up from surgery. We can already be there with ice packs, with laser therapy, with passive range of motion. So that's passively moving the joints. From that moment, before the dog is even completely recovered from anesthetic. We can treat it daily in hospital, like you've got physios in hospital settings. You have heart surgery, the physio's got to clear the fluids, the physio's got to get you to sit up, then the physio's got to get you to stand up, then the physio's got to get you to walk until you can go home. But it doesn't stop there. Then you become a physio outpatient or whatever. So the same process can be followed in the veterinary field. From the moment it gets discharged from the hospital, it can become a physiotherapy or a rehabilitation patient outpatient for us. So they will come to see us once or twice a week, whatever we decide. And then we will take them through their recovery back to functions of daily living or whatever the pet parent or client wants as the end result. But we will always have a discussion beforehand as to how realistic is that end result as well. So, and to do that, we use laser therapy, we use hot and cold packs, we use massage and manual therapies, fascial release techniques. I mean, anybody who's been to the physio will use therapeutic ultrasound. I use acupuncture, physios use dry needling. Then we start with weight shifting and kind of like standing and movement therapy. Neurological rehab's a little bit different. If we have to teach the dog to walk again because it's paralyzed, It's a bit of a different component, but we do that. Right the way up to now we've got to build muscle, we've got to strengthen, we've got to do that before we can say, okay, the dog can go and chase its ball again. So all the way to that, and then to come back to do full circle to Retha, we can also do fitness and conditioning for any of the dogs that are in the sports arena. Any of the working dogs, they work really, really hard. The more conditioned they are, the stronger their core musculature, the less likely they are to injure themselves. And we also do puppy fitness, which comes down to, oh, I've got a little Vorswanky puppy. What can you implement in the first 6 to 12 months of its life that are going to set your dog up for success and are going to reduce the risk of injury? I don't say prevent injury. I say reduce the risk. So we can fulfill any and all of those roles. And within our profession, we also have different interests. So some of us are going to be more interested in the sports side than we are going to be in the spinal dogs. But we technically can do it all. Well, I answered your question, Retha. Too much information.
Thank you. No, not
Very
at all.
well.
I actually think this was a brilliant answer and a great conversation point, because my brain is just going like ching, 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 ching. So in what I do, I deal a lot with people that just get a puppy and want to do the best nutrition wise. I'm sometimes thinking my clients get a little bit annoyed with me because I go way beyond nutrition, because I say to them, do the crate training and listen, here's names of physios in your area, go and see a physio. And then they look at me, but there's nothing wrong with my puppy. And it's simple puppy awareness, body awareness, because puppies do stupid things. Okay, they especially, I mean, we've had an Irish Wolfhound, and I mean, they are clumsy lump, and it is it's the most amazing big dog. But she was a puppy. Riley was about 12 weeks old when she thought she was a beagle, and she rushed out of the door and bumped herself. Nothing serious, like puppies run into a door. And she went down the stairs and she went and sat on the grass, and 5 seconds later she couldn't get up, and she was lame for almost 2 weeks. And so after a long period, and that is when I was actually just shortly after that, I attended something where you were the speaker, and I wasn't aware of animal physiotherapy at that stage. I was aware it was there, but that was just only when you had an operation and something like that happened. And you still said she recovered then, and you made me aware of the fact that what they need to look for. And we had the MRI done, not the MRI, sorry, a CT scan done, and there was like a microscopic small piece of bone in a spinal fluid. But that became a neurological issue. Okay.
Yeah.
So now I knew better before that. When she was 8 weeks old, I would have known better how to make herself aware of her body and not doing these stupid things. And I think that is where I almost think that in every puppy school pack that people take their puppies to puppy school, there should be a pamphlet of animal health and hydro saying how important it is to do this, or any physiotherapist in the area, because it is important that you start from a very young age, do the preventative stuff, and be aware what you as a parent can also do in terms of light massages. Because I mean, it's not just about taking your pet once a week for its treatment. I mean, we do. I've got the old age here, so we do leg massages and back massages and things like that to help the work that the physio does to carry on with it. Because like you said earlier, I can't remember if it was in this or before we started, it is how do pet parents and the vet, the pet parent and the physio rehab physiotherapist work together and making the best for your pet. So now I said a lot.
So just to tie in with, puppy awareness and giving your puppy the tools. I mean, when your child learns to walk and your child starts to run, you are there pointing out all of the things and the potential issues that could happen. Animal Health and Hydro actually has an online puppy awareness course that you can take through. It's a foundational level, and we're building on it all the time, but it gives you the basics of how does your puppy develop neurologically, how does your puppy develop musculoskeletally, and what are the basics that you need to implement to create that body awareness so that your puppy is confident and not doing silly things that could end up with an injury that has repercussions for its entire life. I mean, puppies will be puppies, but there are definitely things that you can implement to reduce the risk. Let's put it that way.
And for yourself as a pet parent to be more aware of what not to do. Don't throw that ball that it bounces high. Throw it on the ground level that it chases the ball on the floor. It's simple things like that that I think we as pet parents really mean well, and we want to stimulate our dogs and keep them busy, etc. But we do things that we're not actually aware of the harm that we do. And I think that is where it is so important. And I really hope that everybody that's watching this will make a mental note and go and tell 10 people about how important it is that you look at physio, a veterinary physio, and the benefit for your puppy. It can save you a lot of money. It can save you a lot. I mean, a cruciate operation can cost anything from 17,000 to 30,000 rand, or even more, depending on the dog at this point in time. You might know a little bit better. I think a back IVD, a back disc, slip disc operation is nothing less than 45 to 50,000. I don't know what your feeling about it is, but I really do think I feel that the pet insurance companies in South Africa does not value the role of cost savings that a veterinary physiotherapist can do in preventing these type of things. And for that, I mean, some of the companies that cover physio and rehab, maybe 1 or 2 sessions is covered in an annual policy. And I think this is the type of things that we need to tell. We as pet parents need to tell other pet parents, and we should talk about our positive experiences with veterinary physios, and the benefit that it does for your dogs, because it is it is one of the most important care. For me, that's even more important than to do vaccine. And I'm not saying don't vaccinate, but doing the every 3 months vaccines when they're puppy. You need to get the overall holistic approach on doing better for your dogs structurally.
Hundreds. I agree.
And really, I feel very strong about it.
Yeah, I think the other thing that, I mean, it's a very big interest for me, and it was something that I certainly wasn't taught as a vet, is conformation. So what is conformation? Conformation is how the dog is put together. So, Vorsies have got short legs and long backs. Well, what's going to take strain? The long back. German Shepherds have got what we call abundant angulation behind, which comes with its own set of problems. But Chow Chows and Shar-Peis are very straight behind. They also have problems. So depending on how your dog is put together, we can foresee or we can predict that this dog is susceptible to a cruciate injury or a back injury or a hip problem or whatever. And we can already start steering pet parents in a direction to, with exercise and with careful movement sciences, reduce the risk that that dog will injure itself.
Yeah,
Rita, I think you're still there, Antonette's.
I think so. Antonette added quite a big storm, and I think her internet connection, or they don't have power at the moment. So we can so she's on a generator, and I think I don't think her signal is that great, but I'm sure everybody can. If everybody can still hear us, it looks like okay. There she's back.
I'm back. Yeah, I'm just like, yeah,
Tanya,
it's one of those
let me
things.
say some of the early warning signs that dog parents must not overlook or must look out for. From I don't want to say when it's before it's too late. What is early warning signs that you can give us a little bit of a guidance in terms of? I've got a 3-year-old beagle puppy that is all of a sudden occasionally limping. What would be your guidance to pet parents in terms of what signs do you need to look out for, and what is a telltale sign that you need to now engage with a veterinary physiotherapist?
Sure. It's a good question. I'm going to see if I can break it down for you, because there really are, I think that we need to look at dogs under 1 year. Then we've got kind of like dogs from 1 year to 5 years or 6 years or 7 years. And then we've got dogs from 7 years and older. And I think that the signs are going to be different. So for the young dogs, for the puppies and the juveniles, the sooner, so contrary to what most people, and I was also taught, but what most people understand about, for example, hip dysplasia or elbow dysplasia is they think it's an old dog disease, but they are developmental puppy diseases. So so start with your trainer. Start with watching how your dog moves. How well does your dog sit? How much does your puppy play? Does it go and lie down often? Does it avoid rough play? Those could all be signs that your puppy actually is a little bit sore. So remember that painful dogs, let me go back a step. When dogs are painful, they don't howl. We're always waiting for the dog to cry. By the time the dog cries, it's excruciatingly painful. Okay, unless you have a poodle like mine who's a drama queen. But mostly dogs don't scream when they're sore. They change their behavior. They change the way they move. They change the way they sit. They change the way they go from lying down to standing up. So you really need to become an observer, and you need to become a detective of your own dog. Understand first what's normal. And then you can go, oh, is my dog normal? Okay, here's a little red flag. I'm going to watch it for a couple of days. Or I'm going to training on Saturday. I think I'm going to see if my trainer says anything or asks me any questions about my dog's behavior on that day, because maybe it's different. Maybe the dog is quieter. Maybe the dog doesn't want to play with other dogs. These are all indications, particularly in puppies, that we've got some underlying painful condition. And I'm not talking about rescue pups. They're a category on their own. They have different behaviors brought on by abuse and neglect and things like that. So I'm talking about a normal puppy that doesn't have a history of rescue or abuse. Okay. So, you know, sometimes we'll think that's the way that a dog's legs are bowed are normal, but it might not be. So start with the puppy, what's normal. If your dog is then over the 1 year stage and it hasn't had anything serious going on, it goes into its sort of young adult into middle age, then I would be going, well, again, any limping that lasts for more than 24 to 48 hours needs to be attended to. Watch the dog's behavior. Dogs that have got a chronic pain problem will often either separate themselves from the pack, or they can become more aggressive to other pack members, or they might not want to be stroked by you anymore. Maybe you brush them every night and now suddenly they don't want to be brushed. Oh, is it over a specific portion of the body? You know, maybe it's just over the pelvic region. Maybe it's only when you're coming over one shoulder. So you as the pet parent can gather a lot of information just from the things that you do every day if you become more aware of what is your dog's normal. And that's another reason why I teach massage and hands-on, because you can get so much information from rubbing your dog. Aside from the benefits it gives you from your reduced heart rate and your calming, you can pick up so much information from your dog. So it's one of the things that I love to teach pet parents as well, because it's empowering. And then when you get to older dogs, really, they, so often the dogs slow down and we say, oh, the dog is just getting old. Well, no, chances are your dog has got some underlying arthritis or some other problem that is creating pain, and your dog is slowing down because it can no longer keep up with the pack, not because it's old, but because it has pain. It's not crying out, but its behavior and its movement and its mobility are changing. Oh, used to be able to jump on and off the bed with ease. Not so much anymore. Used to be able to walk up and down the stairs. Can't anymore. Used to jump in the back of my bakkie like this. I couldn't stop it. And now it's hesitating. You have to help it up. So, and the list goes on. I mean, there are lots of things. So I don't know if you want me to give you more, but I think there's a lot that as the pet parent you can observe.
Tanya, we've got a question here from Leanne. She's asked, before you start physio or laser therapy journey with your dog, do you need to do radiology scans first?
So, I mean, I appreciate the question. So I'm going to come to you from a vet's perspective, because essentially that's my training. I'm as good as the information that I receive. So if it is possible to do radiographs, I'm going to have a whole lot more information than the dog that comes in without radiographs. Okay, but having said that, that doesn't mean we take the dog in, there's something wrong with my dog, and we expect the vet to x-ray every single joint, because that costs a lot of money. So look, much of my practice, I get referrals from other vets, by which time I have a diagnosis. The dog has gone through its process and it comes to me and, it has, a narrow disc space in the neck, or it has arthritis of the elbow or whatever. And usually radiographs have been taken and I can work from there. If I get an old dog where I don't have radiographs, I don't have x-rays, and the dog comes in, my skill level is enough that I could probably pinpoint the area of discomfort. But that still doesn't mean that I know what's going on. And so when I'm treating with laser, or when I'm setting up a program, I'm only as good as I've identified that area, but I don't actually know what it is. Is it arthritis? Is it a bone tumor? Is it a joint infection? Is it a tendon issue? So it's not a simple answer, but the more information that is available to me as a vet or as a physiotherapist, the more specific my treatment can be. And therefore, the more effective my treatment will be, the better you will have spent your money or invested your money. I hope that answers Leanne's question.
It's a very good answer, but I do think and like you said, you've got to look more beyond that, because if you've got a 10-year-old giant breed dog that does not do well with anesthetics to be able to do the diagnostic scans, then you've got to make a call. Is what are you going to do with the information in terms of that? And that is one of the hardest decisions or hardest things to know as a pet parent. Where do you go from there? I mean, I use my pack as an example. So Leia's 12 years old and she tore her cruciate. I mean, it was off. You could feel it. Me that doesn't have any training could feel it's off. And I just knew I could not put her under anesthetics at that point in time, because she's got a lot of other issues as well. And so we had to work with that. It is important for us as pet parents not to feel guilty if you cannot do that.
Tanya,
but it is so much better if you can.
I can.
We can hear you, yes. So it is all about dealing with the dog in front of you. But thank you. It's a very insightful answer.
So Rita, if I can just close that off, that doesn't mean that I won't work with a patient if I don't have radiographs. It means that it's all about the conversation. So yes, I understand that there are dogs that are high risk, and just because we can doesn't mean we should. So the conversation will be, oh, you have a 12-year-old dog that's torn its cruciate, or you have a 12-year-old dog that's limping, and maybe you're a pensioner and you don't have the money to spend on x-rays. Then I'm going to also explain to you as my client, here are my shortcomings because I don't have all of the information that I would like. So let's work with your dog for 2 or 3 sessions and see if your dog responds. If your dog responds and you're happy, lacquer, we carry on. But if your dog doesn't respond, in order for us to get a better result, I might be asking you to go for those radiographs. So again, it comes back to communication.
Together. Yeah, communication and working together, and in terms of it. What are the? Sorry, I don't want to repeat my questions. What is some of the most rewarding cases? Tell us a little bit of rewarding cases that you have seen and transformations. I'm sure you can keep us busy the whole night about that.
It's one of the reasons that I've stayed in this aspect of veterinary medicine, because I've been really fortunate that I've got such dedicated clients that I have been able to work with dogs long-term, especially neurological dogs, where the profession, we were taught to give up on them. But the clients can't give up. And as long as the dog is happy and not suffering and the clients are dedicated and we're going to do it, the results we've seen 6 to 9 to 12 months after the rest of the veterinary profession has given up on that dog is unbelievable. So, and that doesn't mean that we can't work. It's not only for people who have got deep pockets. We can do home programs and still make a difference if you are committed to doing the home exercises. So just recently, we treated a polyradiculoneuritis dog. So polyradiculoneuritis is a sudden onset over anywhere between 4 to 7 days of ascending paralysis. So it usually starts in the back legs, comes forward, hindquarters, eventually the front, and eventually you can have a dog that is paralyzed in all 4 legs. So this was it's just a couple of years old, wirehead fox terrier, but the ones with the long snout, not like the ones I spoke about earlier. And they're such feisty little dogs, and he's only a couple of years old, and now he's a quadriplegic. The vets made the correct diagnosis, and the treatment is physiotherapy. And we had him in our step-down facility. So we actually looked after him day and night. And when he got there, he actually couldn't even lift his head. We had to prop him up over our legs to actually hand feed him. That's how bad he was. And literally 3.5 weeks later, he walked home. He walked out. So that is like, for me, it's a miracle. It's just like we get to perform miracles every day. Those old dogs with the cruciates where we can't actually do the surgery, well, we can manage the pain, we can help them with their mobility, we can strengthen their muscles, and hey, who knows, they could go on to live for another 2-3 years. So yeah, Retha, like for me, every animal is a miracle. Every one of them gives me so much pleasure. I can't tell you, it's just amazing.
It really is a truly rewarding job that you've got. I think you are doing something that, in my opinion, is one of the most rewarding outcomes. I know you do get the ones that doesn't, but I mean, if I've got 3 dogs that has got cruciate issues, and like I said, they're all 12, and Harvey. He had a back op. They said it was a cruciate and he was supposed to go in for a cruciate operation. And while they did the scans and everything, they said, oh, no, it's not a cruciate. It is his back. So he had a 9-hour back op that was actually, let's say 80% successful, and he developed an ulcer. And then while he was still in crate rest, and I'm very strict with it, he went for his 2 weeks checkup, and they said, oh, both his cruciates are off. And I said, but it's impossible. 2 weeks, he had absolute no, he was in a crate all the time. So we'll leave it at that, but we couldn't do the cruciate operations because he developed the ulcer, and I mean, a cruciate is an extremely painful thing, and we couldn't give him pain medicine to go through that. So we had to work with physio, and I mean, he has got trembling, but it's now almost 5 years later, and he's still going strong. But he gets weekly physio. That is important. He gets acupuncture, so it's a management thing. But the rewarding outcome of what you guys do for me is it is as a pet parent, it is amazing to see what you can do with rehabilitation in terms of physio. And I'm going to say it again, I think it's way undersold, and we need to tell, each of us must go and tell not 10 people, 20 people how amazing vet physio is and how important it is for our animals.
Yeah, and I would say, please tell your vets, you know, like we've still got a portion of the veterinary population where they think we're just a waste of money. So the more you have these conversations, the more it becomes the norm within the veterinary field. So yeah, and we're talking specifically small animals, but of course, equine practitioners have been using physiotherapists for years, for decades. So, you know, the horses have been part of that world for a long time, particularly because of the racing and the show jumping and stuff. So they're like the forefront.
And the amount of money in the sport that it is.
Yeah.
Yeah.
For sure.
Yeah.
So I think like one other case that is coming to my mind, speaking about the older dogs, it was a...
I would love to ask a question, but my internet connection is so poor.
Go ahead.
I don't even know if you guys can hear me. All right. Last one. This is from Vicky. Vicky Fox. She runs the Agility Center in the Strand.
Hello,
and
Vicky.
She wants to know, she's got a senior dog that did agility. And what's the most important mobility exercises to do with a retired agility dog?
I don't think you should underestimate slow controlled walking. I did. Slow controlled regular walking. Unbelievable. So low impact, by regular, I mean every day, would be my go-to. The next thing that I would do for one of those dogs, particularly if they've got a lot of mental activity still, is I would do things like scent work and trails. So you're using their brain while they are searching or following a scent or a trail. But that's usually quite slow. So they're engaging their muscles, but they're actually doing it at a slow speed, and their brains are, when they use their brains that way, they tire more quickly than if it's pure physical exercise. So walking and scent work would be top of my choices. You can continue to do a lot of flexibility exercises, so a lot of stretching, like cookie stretches, and even stretches down and stretches up, to keep them flexible and mobile. So any weight shifting, anything like that, I would say would stand them in good stead to keep them working. But everything low impact and preferably controlled. I hope that answers Vicky's question.
Thank you.
Great question. Great answer. Thank you. So what is that? What's our time? What's our time looking like, Antonette?
We've got like 50
we've
seconds.
got a minute
Tanya,
left.
can I ask one more question? We spoke before, and I'm not sure if you guys touched on it, but that collaborative approach that you have, and you mentioned once, we've chatted before, like when you take your dog to puppy school, it's so important for the trainer to also observe the puppy and to tell the pet parent, listen, I'm seeing something. You need to have this checked out. I know one trainer, she said to me that she had a a puppy in the class, and she refused to take it for classes any further until they went to see a vet and a physio.
Yeah, excuse me. I don't think we must underestimate
it's important, that collaboration, and everyone is looking to see what is normal.
Yes, and I don't think we must underestimate the the ability that trainers have, and groomers too, to observe the dogs and what's normal. And so we also, as vets, we also need to appreciate that they have observation skills that we do not. And therefore we should be taking it into account. Like, they're not telling me to do my job. They're giving me information. What am I going to do with that information? So, yeah. And for the pet parent, it doesn't mean just because the trainer's seeing something, it's don't go the disaster route until you've actually taken time to figure out what it is. Just because she's seeing something doesn't mean, oh, now the dog is, its life is over. No. We just step by step, we work through and we figure out what it is that's happening, and then we manage it.
Yeah.
Brilliant.
Cool.
So, Tanya, from the bottom of all of us, thank you. We are definitely going to make this a regular thing. You have given us so much information, and I'm sure there could have been a lot more questions, but you gave us such a good insight in what is important. And I just want to say is, Antonette will post a little bit, maybe if you send us the link to your course about puppy awareness that you do, because I do think it's something that pet parents need to understand. And just lastly, tell us, I think you mentioned earlier that you have got some specials running at the moment at some of your practices. Maybe some of our listeners or viewers can look into that. And really, I would recommend every single pet parent out there to actually engage with veterinary physiotherapy. So if you can give us a little bit more information and tell us where your practices are and where can they find you or your therapists.
Perfect. Thank you very much. And thank you for this opportunity. I mean, I've had a great time talking. So I think you can tell I like it. But thank you for the opportunity to share everything about vet physio and veterinary rehab. So currently 3 of our 6 practices are running this special. So it's Belleville in the Western Cape. It is our North Riding branch in the west of Johannesburg, and our Mooikloof branch in Pretoria East. And literally what it is a free initial assessment it's a less 50% off the initial assessment and a free first treatment. So it literally works out to a 68% discount on those 2 items. And the idea is to say, come, let's make the appointment, come and see what vet physios do, not only the initial assessment, but come and experience a 30-minute treatment session as well, and then see whether you have seen any value. So we're also doing it to try to increase the awareness of vet physio and vet rehab. So those 3 branches. We also have a branch in Deep River in Cape Town and a branch in Newlands. They currently are not running the specials because they've got lots of patients and it would be difficult for them to fit it in. And then Benoni is the original branch, also not running the specials, but we've got a branch in the east of Joburg as well. So is that everything? I think that's what Retha asked me for. Yeah.
Yes, no, that's a brilliant special. I would actually take you up on that because
so there are terms and conditions, like it has to be a new patient. It's not valid for existing patients and so on. So
yes. Yeah. No, we'll definitely. I'll do a little post for you as well. If you've got something on socials, we'll share it and make sure that people know about it. Yeah.
Thanks, Antonette. I appreciate that.
Great.
Yeah.
Yeah.
I've had great fun. Thank you so much for this evening. And thanks to everyone out there
as well.
everyone who sent questions and who stayed to listen.
Yeah, I know we've had some really great responses, people saying thank you very much, and it's been very insightful, and yeah, so brilliant. Thank you, Tanya.
Love it.
Thank you very much. Rita, are you still there? Looks
So
like
often
she's
too.
gone.
Every now and again.
Dis 'n in en uit besigheid vanaand hierdie. So, but yeah, we'll share the recording. We'll share it, and I'll make sure I send you the link as well, Tanya, so you guys can share it as well.
It helped quite well till now. So listen, thank you, everybody. We'll see you next week.
All right.
And
Cheers.
we are.
Can we tell them
Who's
who's
next week, Antonette?
It's Dr. Loan and Sasha, and they're going to talk
I don't
about.
know.
Huh? Yes, man. Tell them. I've already spilled the beans.
Yes. No, tell them. Tell them.
Okay. Dr. Loan is an ophthalmologist. Okay. And Sasha Odeya, they both from Ode Vets and Ode Vision, and they're going to talk about the impact of eye health on behavior. So that's going to be interesting. So
I do want to say they are very, very knowledgeable ladies, and I'm gonna log on and listen.
Great stuff. We'll see you next week then.
Perfect.
All right. Thank you very much.
Bye.
Thank you very
Have a good
much,
evening.
Tanya.
Bye.
Antonette, have a wonderful week. Everybody, will see you next week. Keep well.
Bye. Bye.